Okay, today we're going to teach you how to make critical care for your bunnies. It's pretty simple. Best place to get critical care is call your vet. They can order it for you. You don't really need a prescription. Tell them you want it just in case for emergencies. Um, I give Mr. Hopper critical care all the time now, so our bag kind of got worn out, so I stuck our critical care in a big Ziploc baggie, put the date on it, so we use the freshest one first. It looks like a simple powder. Mr. Hopper has his own bowl that we use just for his critical care. Today I'm doing 3 syringes, which is 1 feeding. It's always 3 tablespoons of critical care per pound of the bunny. So if a bunny weighed 1 pound, you would do 3 of these for a day's meal. It says right on the bag on how much to get. Depending on the size of your rabbit and the appetite of your rabbit, you might want to go a little more, you might want to go a little less, but 3 tablespoons per pound of rabbit is a baseline. Always consult your vet just to make sure. So what we're going to do here is I have a tablespoon, and each 35 milliliter syringe will hold about 1 prepared tablespoon. So I have 3 syringes. I'm going to take this and put 3 tablespoons of critical care. 1, 2, 3 tablespoons of critical care there. Always try to keep the air out of your bag. It helps it stay fresher. I have 9 tablespoons of warm water. It's 3 tablespoons of water per 1 tablespoon of powder. So I'll pour this in here. It's best to use warm because it mixes a lot easier. Plus it just works really well. Just keep on mixing it. Make sure you get an even mix. It should be thick, almost like a toothpaste kind of consistency when you're done. I've gotten so used to the smell. The smell is something you'll have to get used to. It's an odd scent. So make sure you get everything scraped up from the bottom so it's mixed up good. You can change the consistency however you feel you need to for your rabbit. You can have it more watery, you can have it more thicker if you'd like. Depends on your rabbit's preferences and yours for how you want to give it. Nice and thick. That's how it should. Now, you can give it to him like this. Mr. Hopper likes his a little sweet, so what I did was our vet recommended Agrave nectar because it's raw. It's 100% organic. There's no chemicals in here, no nothing that's going to hurt them. Just want to put enough in there. Just give it a little flavor, just so it's a little sweeter for them. You can add a little bit of pumpkin if you want, or a little smashed banana if your bunny prefers that. But just use a little less water because it'll make it a little watery for you. So we're all mixed up here. Okay, I've got a tiny baby spoon. This I found was the easiest way to put it in the syringes because, as you can see, the hole's not very big. It's kind of a pain to get it in there. And it takes a little bit of practice to be able to do this without making a huge mess. So keep yourself a paper towel on hand just in case you decide to make a big mess like I always manage to do. Just take your time. Fill it up. Since Mr. Hopper eats this, and this is pretty much his main diet of food, I try to prepare his whole meal for the entire day, prepped, and then I put it in the refrigerator. And then from there, what I do is I just pull it out about 25 minutes beforehand to warm it up a little, so that, you know, it just sits out a little bit so it's not ice cold for him. He likes it cold, so it's not as big of a deal for him. But make sure you hover over your bowl when you put your top on. Squish down a little. One prepared. That's all it takes, and then repeat the step for each one. So, really simple, real easy to do. Essential skill for your rabbit, especially if they do go into GI stasis, because it is extremely dangerous. It's known as the silent killer and can kill your bunny within a day, even though people don't realize how dangerous it is. I will do another video on showing how to administer it as a feeding. This is just to start everything off so you people know how to actually make the critical care. A little hint, when you're done with your bowl, don't sit it in your sink and then do it later with your dishes. Rinse it out right away, because it will get crusty around your bowl and it'll be hard to scrub off.